Hey everyone, my name is Dr. Allison Hansen, and I'm the Ultrasound Director for the Emergency Medicine Residency here at Tampa General, University of South Florida, and I'm here to talk to you about some basics in point-of-care ultrasound cleaning and disinfection. Now, proper cleaning technique is not specific to any one specialty. This guideline for ultrasound transducer cleaning and disinfection that I'm going to speak about comes from the American College of Emergency Physicians, but the information here, again, isn't specific to emergency medicine. This actual information comes from the American Institute of Ultrasound and Medicine. The Society for Hospitalist Medicine, if they do have a guideline for transducer cleaning and disinfection, will undoubtedly be the same exact information. Cleaning standards are set by the manufacturer, but requirements vary by institution. Infection prevention have their own set of standards, which are influenced by Joint Commission, OSHA, CDC, and other governing bodies. So you may work at a place that does not allow, for example, gel bottles, and they only want single-use throwaway packets. There are policies with sound evidence, and be honest with you, some without. So our job is to do what is right for the patient and being in good graces with our local authorities, so our privileges are not relinquished. We need to define a few terms. So if you do speak to local infection prevention team, you are all speaking the same language. So what is a critical device? Basically, that is an intraoperative probe, ultrasound probe that's used in a sterile body cavity. That is not something we use at the bedside, so just you can get rid of that. We use semi-critical and non-critical devices at the bedside. Semi-critical come into contact with mucous membranes, like transesophageal echo and transvaginal ultrasound. What you're going to be using at the bedside more likely are non-critical devices, basically ultrasounds that come into contact with intact skin. What is cleaning? Well, cleaning is removing of visible or gross contamination. Disinfecting is the use of chemical or thermal means to kill microorganisms such as bacteria, viruses, and sometimes spores. There is low-level disinfection, mid and high-level disinfection. At the bedside, we're going to be performing low-level and mid-level disinfection. That's with our chemical wipes. Again, low level destroys most bacteria and some viruses. Mid-level destroys bacteria, viruses, and things like TB. High level, again, uses chemical or thermal means that can remove spores. And high-level disinfection is when you send your probe to the, let's just say, ultrasound suite. They throw it in a machine. They use hydrogen peroxide and kill all the microorganisms, to include spores. What is a protective barrier? Well, a protective barrier is anything you put over the probe. Most of the time you're going to be using a sterile commercial grade probe cover. Some people use Tegaderm and others might use like a glove. I do not recommend it. All have various pore sizes and have, various evidence behind them. We do know that commercial grade probe covers are definitely sterile and safe to use on non-intact skin and during percutaneous procedures. Let me go back. I don't recommend using a Tegaderm. That oftentimes leaves like an adhesive film, and it can collect dirt and gross contamination. I wouldn't recommend you use that. Ultrasound gel. Well, we know what ultrasound gel is. It can come in multi-use containers, which are not sterile, or sterile single-use packets. You want to use the sterile single-use packets when you're performing, obviously, sterile procedures. And I highly recommend it when you're doing percutaneous procedures. Again, just because the multi-use containers sometimes come into contact with people's skin and they are not considered sterile. So when you're performing a procedure, it's probably best to use these sterile single-use packets. Now, in between patient ultrasounds, this is where your low and mid-level disinfection comes into play. You will be performing low and mid-level disinfection between ultrasounds on intact skin. So when you perform an ultrasound on clean, intact skin, that's considered non-critical, and basically you can just use these wipes in between patients. Now, I say low level and mid level because these wipes that we use in the emergency department, the gray AF3 wipes, actually kill TB, which, if you look at our previous definition, is considered mid-level disinfection. But for our purposes, when you're at the bedside, you're performing an ultrasound on intact skin. After you're done, you clean it with the gray AF3 wipe. And you only use the gray AF3 wipe. And I mean that because if you use the purple or the orange, over time that's going to degrade the probe, and the probe is extremely expensive. Only gray AF3 wipes on the ultrasound probe. I would recommend on the machine as well. The orange bleach wipes leave a film. Now, if you're, say, performing an examination on intact skin and it comes into contact with a patient's bodily fluids, you want to clean it with these gray F3 wipes and consider sending it to the department that you have a previous agreement with to have high-level disinfection performed. Again, high-level disinfection isn't necessarily always needed, but for our purposes, I highly recommend it if you're performing an ultrasound and it comes into contact with blood or bodily fluids. There are some wipes that are considered high-level disinfection, but we do not have them at our institution at this time. If you have any specific questions about cleaning or disinfection of the ultrasound probes, please reach out to me. I always have Epic Secure Chat open, or you can also email me. Remember, in between patient encounters, when performing ultrasound on intact skin, you can just clean with the AF3 gray wipes. If you're performing a percutaneous procedure or performing an ultrasound on non-intact skin, such as infected skin where there's a cut or a post-op surgical incision, please always use a protective barrier. I recommend the commercially available probe covers that we have at Tampa General Hospital. If you're performing any sterile procedure or percutaneous procedure, use the single-use sterile packets of ultrasound gel, as well as, again, those commercially available, usually sterile ultrasound probe covers.